download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni. Let's look at today's daily bulletin. Delhi launched 1,537 fresh COVID-19 cases on Tuesday with a positivity rate of 26.54% according to data shared by the city government's health department. With the new cases, Delhi's COVID-19 tally has climbed to 20,25,781. 5 fresh fatalities have pushed the death toll due to the viral disease to 26,572 according to a bulletin issued by the health department. Of the latest fatalities, COVID was the primary cause of death in 2 cases. While considering the matter concerning admissions to the College of Physicians and Surgeons courses, the Bombay High Court directed the state on Monday to provide all documents to CPS so that it can answer the show cause notice issued by the Medical Education Department of the state. Directing the state to provide the documents, the High Court bench of Justice Gautam Patel and Justice Neela Gokhale has listed the matter for further hearing on 26th of April. Even after clearing the foreign medical graduates examination, MBBS graduates from abroad are facing difficulties to get themselves enrolled for the mandatory 2-year internship program in India. Due to the scarcity of adequate internship seats, around 2,000 such FMGE doctors are facing an uncertain future as they will not be able to register or practice in India without completing the mandatory internship rule of the NMC. A doctor at a private hospital in the Raipur area of UP has been booked in a case of alleged medical negligence where a young man had died during appendicitis surgery due to an overdose of anesthesia. The authorities sealed the hospital and its director was slapped with a fine of Rs 2.5 lakh. The patient died back in November last year and now a case has been registered under Section 304A of the IPC against the doctors and other staff members. An FIR has been registered against a doctor of a private hospital here and other staff members following the death of a young man allegedly due to an overdose of anesthesia for surgery, police said on Monday. Top Indian-American oncologist Dr. Dattatreyudu Nori has been appointed senior advisor to the Chennai Center of the prestigious Memorial Sloan Kettering Cancer Center from New York. Observing that the opening of Memorial Sloan Kettering Cancer Center from New York in India, the first of its kind outside US, is a big deal, Dr. Nori said. Getting treatment of and consultations on cancer from the world's best cancer institute would not only save a large number of lives, but will also help to increase awareness in the fight against the deadly disease. A 2007 Padma Shri awardee for his contribution to the field of medicine, Dr. Nori said he wants to bring the best practices of cancer treatment from the United States to India.
Vitamin D deficiency could be the reason African American men experience more aggressive prostate cancer at a younger age compared with European American men, new research from Cedars-Sinai Cancer suggests. The multi-institutional study published in Cancer Research Communications, a journal of the American Association for Cancer Research, could pave the way for revised nutritional guidelines. African American men are more likely than European American men to develop prostate cancer and are twice as likely to die from the disease, said Moray Campbell, who is a senior author of the study. Tisch Cancer Center scientists have developed unique models of the deadliest blood cancer, acute myeloid leukemia or AML, creating a transformative resource to study this cancer and eventually its drug response and drug resistance. The models were described in a late-breaking abstract at the annual meeting of the American Association of Cancer Research and simultaneously published in Blood Cancer Discovery Journal. These are the first powerful models that are nearly identical to AML found in patients. The researchers said these models represent the disease accurately in genetic composition and in disease characteristics found in laboratory cell cultures, animal models, and patients. Patients with gum disease are less likely to respond to rheumatoid arthritis treatments, but new research may help explain this link between gum disease and an otherwise disparate condition. The findings suggest that breaches in damaged gums allow bacteria in the mouth to seep into the bloodstream, activating an immune response that ultimately pivots to target the body's own proteins and cause arthritis flare-ups. The Darnell lab had been following a small group of arthritis patients over the course of several years, collecting weekly blood samples and looking for changes in gene expression to help explain why painful flare-ups occur when they noticed a surprising trend. Two of their patients who had moderate to severe periodontal disease had repeated episodes of oral bacteria in their bloodstreams. even when they weren't having dental work. When a person reads a sentence, two distinct networks in the brain are activated, working together to integrate the meanings of the individual words to obtain more complex, higher-order meaning, according to a study at UT Health Houston. In order to identify the specific roles and interactions of the brain areas involved in reading, the research team performed recordings from the brain of patients with electrodes surgically placed to localize epilepsy. The neural activity of these patients was measured while reading three forms of sentences: regular sentences, Jabberwocky sentences, which use correct grammar and syntax but contain nonsense words, making them meaningless, and list of words or nonsense words. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.